Hello, I'm Dr. Coral Olazagasti with Sylvester Comprehensive Cancer Center at the University of Miami. And today I want to talk to you about an important study that we're conducting on the early detection of lung cancer. Cancer occurs when the body cells start to multiply uncontrollably. When this happens in the lungs, it's called lung cancer. Lung cancer can spread to lymph nodes or other organs such as the brain. Similarly, lung cancer can spread to other parts of the body in a process known as metastases. People who smoke cigarettes are 15 to 30 times more likely to get lung cancer. Sadly, lung cancer is the leading cause of cancer death worldwide. If you have had cancer before, you might wonder, why should I be concerned about lung cancer? But having a previous history of cancer significantly increases the risk of developing lung cancer, nearly 3 times higher than those without a prior history of cancer. This is why we have initiated this study, specifically focusing on Hispanics who have had a prior history of cancer. We recognize the needs and risk of this population who are often excluded from studies and overlooked in broader health situations. There are notable disparities in lung cancer amongst Hispanics. More Hispanics are diagnosed at advanced stages compared to non-Hispanics. Furthermore, fewer Hispanics meet criteria for early screening, and even those who do are less likely to be referred for screening. In Florida, only 2.4% of people at high risk were screened, much lower than the national rate of 4.5%. Florida ranks 40th amongst all states for lung cancer screening, placing it way below the average tier. We want to help you get the test that you need to rule out lung cancer. The only recommended screening test for lung cancer is low-dose CT. This screening test is advised for adults at high risk who do not have any symptoms. Screening means testing for a disease when there are no symptoms. During a CT screening, you lie on a table while an X-ray machine delivers a low dose of radiation to produce detailed images of your lungs. The process takes a few minutes and is painless. Who should be screened for lung cancer? People with a smoking history of 1 pack a day for 20 years or more, who smoke now or have quit within the past 15 years and are between 50 and 80 years old. You can get a CT scan at most major cancer centers, including Sylvester Comprehensive Cancer Center. A chest CT scan can identify abnormalities throughout the chest and upper abdomen that may be cancer. If a nodule suspected of being cancerous is found, further testing such as repeat CT scan, PET-CT, or biopsies may be required. A biopsy involves removing one small piece of tissue to be examined under a microscope. CT screening for lung cancer is not a one-size-fits-all test. It may involve annual follow-ups and additional testing if necessary. Early detection is crucial because lung cancer is the deadliest cancer in the world, but it is treatable if diagnosed early. More than 80% of patients who have lung cancer detected by CT scans are treated successfully. Miami has the highest incidence of lung cancer in the Hispanic population. Early detection can make a life-saving difference. When the right treatment is provided immediately, the cure rate exceeds 90%. Research has shown that those who had a lung cancer diagnosis after having a low-dose CT scan had a 20% lower risk of death from lung cancer than those who didn't. We care about the well-being of our community. Join our study to help us make a difference in early detection of lung cancer. Your participation could save lives, including your own. For more information and to participate in our study, please contact us. Together, we can fight lung cancer with early detection.